What is immunotherapy?
So immunotherapy is obviously a very hot topic for cancer in general, and AML is no exception, although I think AML is not as far along with respect to successful immunotherapy approaches as, say, other cancers, perhaps such as melanoma or lung cancer. But immunotherapy in AML, I guess the gold standard for immunotherapy would be bone marrow transplant, where a patient receives a brand new population of bone marrow stem cells from a healthy donor, and that stem cell population recreates a brand new immune system that is responsible for fighting off and destroying any leftover leukemia cells in the patient, and that's felt to be related to something called graft versus leukemia effect, which is where the donor immune system basically recognizes the host cells, the host's AML cells, as being foreign and helps to eliminate them. So that's probably the current definition of the ultimate type of immunotherapy is bone marrow transplant, where you get an entirely new immune system. Other immunotherapy approaches include things like monoclonal antibodies, where you have an antibody that is developed and it targets or it attacks a specific type of cell that contains a protein that the antibody recognizes. So the main drug that we have approved for AML is called gemtuzumab or Mylotarg, and that is an antibody that recognizes something called CD33, which is seen on the surface of the AML cells very often. So the antibody basically recognizes a CD33, latches onto it, and then it delivers what's considered a payload or a toxin into the cell after it attaches to the cell and kills the cell. So that type of therapy has been moderately successful in AML, most often in combination with other drugs, not necessarily by itself. There are other antibody drug conjugates that are being developed that go after other targets, such as CD123. So there are trials right now that are looking at CD123 antibody drug conjugates, either alone or in combination with other types of chemotherapy, to help augment the overall effect of chemotherapy by adding this antibody component. We also have something called bispecific antibodies, which are a little bit of a different type of antibody-based therapy. In the case of bispecific antibodies, you have an antibody that basically recognizes two different things. It recognizes a target on the leukemia cell, and it also recognizes a target on the immune system cell, such as a T cell. And it brings those two, the antibody kind of links those cells and kind of brings them into close proximity that wouldn't be achieved otherwise. And by having this T cell close by to the leukemia cell, it's felt that that helps the T cell directly induce leukemia cell death through the release of various chemicals and cytokines that are based upon the close proximity of those two cells. There are other types of antibody therapies being developed that block certain signals on the leukemia cells that protect the leukemia cells from the immune system. So by blocking these do not eat me signals, so to speak, this antibody can sort of turn on the immune system in a way that now allows the immune system to recognize the leukemia cell and engulf and destroy it, whereas otherwise it would be protected.
Are there any immunotherapies currently available for AML?
I was blessed at Memorial Sloan Kettering Cancer Center to be one of the first to talk about immunotherapy targeting specifically complications after allogeneic stem cell transplantation. One of the diseases that initially develops after transplant is an EBV-derived post-transplantation proliferative disorder, or EBV-PTLD, which has been very lethal within a very short time period. And we really had no drugs in the early stage to treat this complication. Then we found out that the administration of donor T cells or donor lymphocyte infusions could control effectively the disease, the EBV PTLD. Donor lymphocyte infusions basically were the birth of immunotherapies. So now we know in more detail than 20 years ago that that some of the T cells can specifically recognize a tumor cell. Nowadays, we can generate T cells in the laboratory or modify T cells to specifically, genetically modify T cells to specifically recognize a tumor cell. And the platform for that is the CAR T cells. Now we have a monoclonal antibody genetically introduced into a T cell, and with that, the antibody can bind to the tumor cell and bring the T cell to the site of the tumor cell. So that is a prime example of immunotherapies. For acute myeloid leukemia, we talked about this before a little bit. It's complicated because the target of the CAR T cells would be the CD33, for example, that is also expressed on the healthy hematopoietic stem cell. Therefore, we need to come up with novel approaches to achieve a remission in patients with AML by CAR T cells. And the way to do this is to downregulate or silence the expression of CD33 on the normal hematopoietic stem cell, transplant the patient with CD33 negative stem cell product, let them engraft. Then we can treat patients specifically targeting CD33 with donor-derived CAR T cells because the leukemia cells are the only ones that then express CD33. First step, we'll collect the stem cells from the donor. We'll purify the stem cells, which we do in the laboratory by selecting out the stem cells by CD34 selection, depleting all the other cells that are left. So you have a 99% pure population of normal hematopoietic stem cells. We'll send them to a different laboratory to downregulate by CRISPR technology the CD33 expression. And then you end up with a CD33 negative stem cell product. That gets infused into the patient. They engraft with CD33 negative stem cells, have a normal immune reconstitution, and then you can come in with specifically targeting CD33 expressing cells, which are only the leukemia cells left that have the CD33 molecule.